From closed ERs to long waiting lists, the doctor shortage has been felt in many different ways around Ontario and even here in Waterloo Region. A pair of local medical students have started visiting high schools, hoping to create solutions by convincing students to consider a path in medicine in underserved areas. CTV's Spencer Turcotte reports.
Temporary emergency room closures are impacting rural communities across Ontario, as we have seen in reporting on places like Chesley, Listowel, and Clinton. It's largely due to a lack of physicians and healthcare providers. But these two medical students are trying to change that.
A lot of the surgical wait times right now for elective procedures are up from 6 months up to a year. Many patients are waiting really long times, and this effect is even more so exacerbated in rural communities.
The pair, who attend McMaster University's Waterloo Regional Campus, have launched Bridge to Med. It's an outreach program that visits rural high schools like Waterloo Oxford to speak to students about the path to medical school and how they can be part of addressing those gaps.
And that means future doctors, future nurses, future respiratory therapists coming to regions that are in Baden and New Hamburg and surrounding hospitals, and people that are more okay with working in those communities because that's where they grew up.
When the group of high school students were asked whether they had considered a career in the medical field, many raised their hand, including grade 11 student Izzy Shirey.
I didn't really know there was a shortage of anesthesiologists. Yeah, I thought that was like a really competitive thing that everyone wanted to get into.
She has seen firsthand how a lack of medical care close to home can impact families.
My grandma had a brain issue and she had to go to the States just to get a CT scan.
With Ontario's Health Coalition reporting 1,117 emergency department closures in the province last year, Vivek and Blossom hope introducing rural high school students to the medical field at a young age will help Canadians long term.
And should they pursue that and eventually be working as a doctor, they would be the ones most likely to come back and work in sort of those communities that need it most.
Spencer Turcotte, CTV News, Baden.